Hi, folks. Welcome all. We'll be starting in just a second. I see that there's a bunch of you already trickling in. Thank you so much for taking the time and joining us today. My name is Carolina Jimenez. I use she, they pronouns. I'm a person of multiracial ancestry and came to these lands as a refugee from Colombia. I'm speaking to you from Musqueam, Squamish, and Tsleil-Waututh territory, Vancouver, and for today's webinar, Rebecca and I are happy to host How Can Public Health Promote Decent Work as a Social Determinant of Health? And I'll pass it over to Rebecca so that she can introduce herself today.
Thanks. Hi, everyone. My name's Rebecca Sheff. I use she, her pronouns, and I'm a white settler speaking to you from what is now Toronto, the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples.
Amazing. Rebecca and I are both knowledge translation specialists at the National Collaborating Center for Determinants of Health, or NCCDH for short, and we're going to be co-hosting today's presentation. To begin our presentation, it's important to acknowledge the land we're on and what's happened on the land, ourselves, and who has and continues to experience colonial and racial violence, and reflect on why that's important for today's presentation. The NCCDH is located in Mi'kmaq, the territory of the Mi'kmaq people, who along with the Wolastoqiyik peoples first signed the treaties of peace and friendship with the British Crown in 1725. It's also important for us to remember that these treaties were signed over 100 years before the end of slavery in 1834 in what is now called Canada. Rebecca and I acknowledge with solidarity with the Indigenous, Black, and Afro-Indigenous peoples who have and continue to resist colonial violence and pursue self-determination. Disrupting settler colonialism, white supremacy, anti-Indigenous racism, and anti-Black racism is integral to our decent work portfolio here at the NCCDH. And today we're going to discuss some of the ways in which white supremacy and racism impact the health of workers and contribute to inequities in the labor market. And we'll also point you to some concrete tools and next steps to help you work in solidarity with Black, Indigenous, and other racialized workers who are striving for safe and healthy work conditions. The NCCDH more broadly supports the Canadian public health community to address the structural and social determinants of health and to advance health equity. We are one of 6 national collaborating centers for public health working across Canada, and we're funded by the Public Health Agency of Canada and hosted by St. Francis Xavier University. Today's session is the second installment of our Decent Work webinars. We're really happy to be here today. We had our first webinar in January where we discussed the problem of precarious employment and hazardous working conditions, as well as the solution of decent work. And in today's session, we're going to be talking about the Decent Work Practice Brief, which we're going to link in the chat. And more specifically, in this practice brief and in this presentation, we'll focus on how we can use our public health roles to advance decent work using 3 specific cross-cutting approaches. The session is throughout via Slido and a question and answer at the end. There's also a question and answer box that you can use to submit questions throughout the presentation. And as I'm sure you've noticed, the presentation is webinar format, so the chat functions are quite limited, but feel free to use the React button or to use the chat to message us if you have any questions. The webinar will be recorded and shared with registrants via email and will be posted on our website. And finally, a special thanks to Carolyn and Pema from the NCCDH who are supporting today's session. I'll pass it over to Rebecca to give us a recap of some key decent work concepts.
Thanks, Carolina. All right, so let's start by reviewing some key concepts that are foundational to today's conversation. And these concepts are covered in our issue brief. If you need a refresher or missed our January webinar, you can check out the issue brief using the QR code on the screen or via the chat box. And the brief brings together peer-reviewed and great literature about work, health, and health equity. And the literature is clear that work is a powerful condition of everyday life that can harm or promote health for workers, their families, and their communities. Now, the evidence shows that work impacts health in two main ways. So first is through working conditions, which are the occupational exposures that workers face while on the job, such as physical, chemical, ergonomic, and psychosocial hazards. The second is through employment conditions, which are the conditions of a worker's contract. And when it comes to health outcomes, it's helpful to think about this on a continuum. So on one end, we have hazardous working conditions and precarious employment conditions that are associated with negative physical and mental health outcomes. And on the other end are safe working conditions and secure standard employment conditions, which are associated with positive health outcomes. Now, precarious employment conditions include low wages, schedule uncertainty, income instability, job insecurity, involuntary part-time, casual, flexible, temporary, or gig employment, and a lack of collective bargaining, limited worker rights, and powerlessness to exercise rights and speak up. Let me take some time to talk about the public policies that shape employment and working conditions. So mainly employment standards laws and occupational health and safety laws. These are provincial, territorial, and federal laws that offer minimum rights and protections for workers. They include worker rights like minimum wage, paid sick days, right to refuse unsafe work. And these laws play a really big role in shaping employment and working conditions. They're particularly important for non-unionized workers who don't have collective agreements and are much more likely to be in precarious jobs. So stronger employment standards create a solid floor of worker rights. And there's a number of other related public policy areas like employment insurance, workers' compensation, human rights, pay equity, accessibility, immigration system, and policies that intersect with decent work. All right, so what we are seeing across Canada is that precarious employment is an urgent health issue for three big reasons. So first, these conditions are prevalent and in many cases are growing. For example, over the past few decades, unionization rates have fallen, temporary work has grown, and the minimum wage has not kept pace with the cost of living across the country. The second is that these conditions are intentional and modifiable through public policy change and worker organizing. And the third is that these conditions disproportionately impact workers who face structural oppression, such as racism, sexism, ableism, and homophobia. So this leads to differential health impacts or health inequities. And I want to provide a bit more information about that last point. So it's important that we are asking and understanding who precarious employment impacts. So persons with disabilities in Canada are twice as likely to report low quality employment. In BC, racialized and Indigenous workers were much more likely than white workers to have secure jobs. Lesbian, gay, bisexual workers in Canada are approximately 3 times more likely to be precariously employed compared to straight workers. And migrant workers face increased precarity due to immigration policy and temporary closed work permits rather than permanent resident status. And this is all a result of discrimination in the labor market and society, inadequate public policy response, and exploitation of workers. We see this discrimination through pay equity data from the Canadian Centre for Policy Alternatives. So in Ontario in 2022, Black men were making 77 cents compared to every dollar white men make. We also see a gender pay gap here, and we see the intersections of anti-Black racism and sexism that Black women experience in pay. So Black women were making 68 cents compared to every dollar white men make. That's a stark reminder of the inequities in our labor market. If precarious employment and hazardous work are the problem, decent work is the solution. So that's the good news. Decent work is a global goal, an agenda for change, and a movement in Canada to confront precarious employment and achieve dignified and healthy working and employment conditions for all workers. And it's a sustainable development goal with a really long history. So decent work contributes to positive health outcomes for workers, families, and communities, and it includes secure permanent jobs, adequate wages, hours, and benefits, adequate minimum employment standards and rights for all workers, strong occupational health and safety protections, a strong worker voice, and collective worker power, and enforcement mechanisms for those policies, rights, and standards. And Dr. Teresa Tam has actually discussed how decent work intersects with public health during the early waves of the COVID-19 pandemic. She said, improving workplace protections, increasing the number of quality jobs, ensuring equitable access to quality jobs, and addressing the impacts of precarious work could support greater health among Canadians and strengthen our collective response to future waves or pandemics. So there's an important role for public health staff and organizations to promote decent work because good jobs protect health and allow communities to be more resilient. So now we have our first Slido, and I'm curious to know how decent work intersects with your specific area of work. So you can use that QR code or that code at slido.com and share with us how decent work intersects with your specific area of work. I'm seeing typing. Income policy, nice. Feminist advocacy implies decent work standards for all. Absolutely. Decent work as an intersection for poverty reduction. Income, I'm seeing a lot of income and poverty reduction. Access to recreation, union. We are a workers' center. So decent work is top of our agenda. Poverty reduction. I exclusively take care of working patients who do not have access to decent work. We're a group of decent work business owners who understand this contributes to better economy. Love that. Prioritize occupational health interventions, food insecurity, lack of benefits, leave protection. This is coming so fast now, and I'm seeing groupings at the top of themes that are coming through. So policy, poverty reduction, food insecurity. Oh, I went forward. Okay, I think we will move on, but thank you so much. It's great to see how you're seeing the intersections in your work. So to conclude this section on the review of core concepts, I just want to highlight precarious employment and hazardous work are pressing sources of health inequity in Canada, and as such are key areas for intentional, well-resourced public health action. So I'll turn it over to Carolina to introduce what this looks like.
Yeah, thank you. I heard my internet was a bit choppy, so if it continues to do so, be warned I might turn off my camera. So next, we're going to dive into the decent work practice brief, which describes how we can advance decent work through the well-established public health roles for health equity framework from the NCCDH. And for each of the roles, we will identify actions and real-world examples from published case studies and reports to make it really practical for you folks. But before we dive into the roles, we need to talk about 3 key cross-cutting approaches that will help us meaningfully advance decent work and health equity. And these are what we call the ABCs of decent work. So A, apply a values-driven approach. B, build worker power. C, commit to intersectionality. These approaches can help us determine priorities in how we carry out decent work interventions to reduce the risk of perpetuating systemic oppression or dampening the existing efforts of worker-led movements. These approaches can be adapted to a variety of public health roles, organizations, and jurisdictions, and can guide us in adapting these actions to our local context, including local worker needs. So, starting with A, apply a values-driven approach. We know that values drive the attitudes, behaviors, and actions that contribute to a particular desired goal, such as decent work for all. And key values that facilitate decent work include humility, trust, reciprocity, and solidarity. And these values are defined more specifically in the practice brief document, but I'll share the definition of my favorite one, which is solidarity. And solidarity is to recognize the interdependence between public health and workers broadly, to link one's well-being to the well-being of workers in precarious employment, and to have a moral obligation to strengthen social cohesion by taking action to address precarious employment and hazardous work. I love that one. The next approach is build worker power, which is informed by the NCCDH's Let's Talk Redistributing Power to Advance Health Equity. Building worker power is a necessary part of decent work. We must build worker power to address the employment legislation gaps, social norms, and business trends that intentionally exploit workers for profit and lead to inequities in the labor market. And specifically here, we mean build the power of low-income, disabled, migrant, queer, women, Black, Indigenous, and other racialized workers. Public health practitioners can build worker power by building relationships with worker-led groups, such as unions and community organizers, by supporting labor campaigns, and modeling shared leadership and decision-making. And the last cross-cutting approach is commit to intersectionality, which is informed by the NCCDH's Let's Talk Intersectionality. Committing to intersectionality transforms how decent work-related issues are identified, examined, and addressed. Intersectionality involves a critical self-reflection of one's power, privilege, and bias, an analysis that names how overlapping systems of oppression, including racism, disadvantage some workers while privileging others of particular social identities, as Rebecca mentioned earlier, and a social justice action that is rooted in the transformational change of racist and inequitable legislation and workplace policies. So those are our three cross-cutting approaches. Now that we've talked about them, let's dig into the public health roles for decent work and health equity. The roles are 1, assess and report, 2, modify and orient interventions, 3, partner with other sectors, and 4, participate in policy development. And as I mentioned, we'll provide real-world examples for each of these roles. So starting with assess and report. Assess and report in the context of advancing decent work and health equity means assessing the problem of precarious employment and hazardous work, as well as the solution of decent work. For example, understanding and assessing how many people in your community have access to paid sick days or health benefits, or for example, understanding the types of jobs that residents or clients in your community are in. Are these jobs unionized? Do folks work for different temp agencies? Are they getting paid a living wage? These are types of questions that you can ask yourself when assessing the problem and potentially the solution of decent work. So next, you should analyze, interpret, and report data in their policy context. This is really important. For example, interpret data in relationship to gaps in employment standards legislation, inadequate enforcement of occupational health and safety standards, and intersecting forms of systemic oppression within the labor market. And lastly, you can do all of the above by collaborating with workers and worker-led groups, which we know can help strengthen data and stories with lived expertise, and it also helps build worker power, which is that cross-cutting approach we just spoke about. So getting into some examples. For those of you who are directly providing services to clients, including public health nurses, registered dietitians, and health promoters, here is a validated tool that can help you assess for precarious employment among your clients. This was developed in 2024 by Ho and colleague, and it's a validated tool that asks 3 key questions. Number 1, are you currently employed in casual, short-term, or temporary position? Number 2, do you feel fearful that you could be fired if you raised employment concerns? Number 3, does your pay vary a lot from month to month? A result of yes of 2 or more questions is a positive screen, indicating the likelihood of precarious employment. Importantly, a positive finding allows you to initiate a conversation about precarious employment and work conditions and allows you to refer clients to legal and employment support services who can deliver workshops and trainings and can also help them understand their rights as workers, can help them protect themselves from health and safety hazards, and can also help them seek new employment opportunities if that's what's best for the client. And these services are provided by organizations such as the Worker Solidarity Network in BC and the Workers Action Centre in Ontario and Halifax. So they're definitely a really great resource to check out. The next example for the assess and report role is about food insecurity coming from Chatham-Kent Public Health in Ontario, which may be applicable to those of you who are involved in data collection and analysis. In 2022, they calculated nutritious food basket income scenarios for the region and found significant financial pressure on those living with low income. They determined that the minimum wage was insufficient to cover the basic costs of living, but they didn't stop there. They framed low wages as a component of precarious employment and called for increasing the minimum wage as a policy solution. So this example highlights the intentional interpretation and reporting of food insecurity in the policy context of an adequate minimum wage. And so for those of you who are involved in nutritious food basket monitoring, this is an excellent opportunity to include decent work policy recommendations. Moving on to the next example. And the last example, this one comes from Peel Public Health in Ontario. During the first few waves of COVID-19, they faced significant workplace outbreaks. Through data analysis, they found that 1 in 4 individuals with COVID went to work with symptoms. But to better understand and respond to this, they prioritized community engagement, including with workers and labor organizing groups, to better understand the experiences on the ground as well as their decent work demands. This approach allowed them to tailor solutions that addressed both specific workplace risks as well as larger systemic issues, including advancing policy for paid sick days. This collaboration between public health and workers built worker power because it validated workers' concerns and it also heard and actioned their demands for decent work. Okay, that concludes our examples for assess and report. We're going to be moving on to a Slido because we're curious to hear from you. What forms of precarious employment or hazardous work issues happening in your communities that you would like to assess and report on? So this could be if potentially you've noticed some clients in that are working in temporary agency work, if you're curious about, for example, the working conditions of migrant farm workers, gig works, and so on. See that there's some folks typing in unpaid overtime, migrant workers. Yes, absolutely. Tourism work, yep, seasonal work, hazardous conditions. International students, yeah, that's a big one. Mental health impacts of precarious employment locally, yep. Pregnant workers, workers required to work sick, yeah, that's a biggie. Skip the dishes, gig work, yeah, absolutely. International students, gig work and proper classification, that's right, misclassification is huge. Uber Eats, so we're seeing lots on gig work, overworking with no proper compensation. Precarious housing, precarious work, yes, absolutely. Contractors, yeah, independent contractors and whether they're protected or not under employment legislation is big. Care work, student jobs, absolutely. See a couple more folks having, and we can see here we've got overtime coming up as a significant theme, PSWs, no benefits, extended hours, lack of diverse hires within an organization. That's right. And that would be also an issue of the larger labor market. Unsafe, psychologically speaking, working conditions for queer and trans folks. Yeah, absolutely. And also disabled folks as well. Contract work year to year. Yep, that's a really important part of precarious employment. Persons with disabilities. Yeah. a necessary requirement for university degrees. Yep, absolutely. Waiting on a couple more folks to finish on typing before I pass it back to Rebecca. Precarious supervision. Great. I'll pass it on to Rebecca to continue on with the public health roles.
Okay, great. So public health staff, nurses, inspectors, health promoters, many others interact with the public and with workers through many different programs and services. So this next role focuses on modifying your programs and services to advance decent work. Specifically modifying programs so that you can reach workers in precarious employment. So for example, someone who doesn't have paid sick days and risks losing their job or income if they self-isolate or go to a clinic, or someone who can't raise issues about hazards at work because they fear being fired. The other part is modifying programs in order to be able to identify, address, mitigate the health impacts of precarious employment and hazardous working conditions for residents and clients. So for example, that screening tool Carolina introduced us to could be used during one-on-one interactions to start the conversation, identify precarious employment, and then make referrals to address or mitigate health impacts. Another part of this role is to transform interventions, to actually build the power and networks of workers, which is the foundation of decent work. And across this role, you can partner with worker-led groups and other sectors to effectively understand and respond to worker needs. And there are many examples of public health organizations modifying interventions to reach workers during the early waves of COVID-19. So for example, Peel Public Health modified how and where they delivered vaccination by setting up after hours, mobile and workplace-based vaccination clinics in order to reach precarious and shift workers, such as workers in warehouses, taxi drivers, and truck drivers, many of whom were disproportionately racialized and exposed to COVID-19 at work. And in Niagara region, public health and emergency services work together. Public health inspectors expanded their role from historically focusing on drinking water and housing for seasonal farm workers to respond to COVID risks and transmission. And they quickly brought in public health nurses to work together to do inspections and case and contract tracing. They quickly ended up modifying how they did that case management to be more flexible and responsive to the needs of workers. So some of those interviews turned into asking, what is happening for you every day? And that allowed them to identify and respond to worker needs more holistically, like helping with groceries, laundry, and sending money to families. They also took a values-driven approach to this work by building trust, relationships, and open communication with workers by being at the farms every day. They also worked with other sectors and modified how they prioritized vaccination. So they were one of the first health units to have a priority mass vaccination clinic just for farm workers. To see an example of transforming interventions to build worker power, we can look to Toronto, where staff at Parkdale Queen West Community Health Centre noticed that nail technicians in nail salons were presenting with similar respiratory and skin conditions. Rather than simply providing medical treatment, they decided to look at the broader factors impacting worker health. So the health promotion team held a focus group and then a roundtable with nail technicians to identify needs and co-develop a program that took an intersectional approach in recognizing and responding to the various needs of nail technicians, such as precarious employment and physical, ergonomic, biological, psychosocial, and chemical workplace hazards, structural labor issues and policy gaps, and anti-Asian racism. And they intentionally built worker power by hiring a paid peer organizer and bringing together a network of nail technicians to build trust, learn together, and collectively advocate for decent work. All right, it's time to hear from you again. So using Slido, as we think about modifying programs and services, we'd like to hear from you. What strategies can you use to reach workers in precarious employment? For example, if a worker fears reprisal from their employer, if they voice concerns about a hazard at work, or if they take time off to self-isolate. So what are some strategies you've maybe used or ideas you're thinking about to reach these workers? Body mapping on the street, done with migrant farm workers in Leamington. Okay, I'd love to hear more about that work. Social media posts. This as a way to communicate. Normalizing talking about unsafe work conditions. Set up employee resource groups at work, example, rainbow staff groups, so that workers can band together and discuss issues without fear. That's a great example of building worker power. Business champions, anonymous feedback forms and surveys, great. This could be a way to identify hazards. Connecting with community leaders, advocates who can help build trust. Yes, trust is one of those important values to bring to this work. Ooh, outreach, building trusting relationships, mobile office, meet people where they're at, device-driven communication, so using things like WhatsApp and Facebook Messenger, etc. Great. I'm seeing a couple more folks typing. Challenge the default of being extractive. Reciprocity is everything. I love that. Getting at that value of reciprocity and not just taking. Snowballing. I assume that's kind of word of mouth, might be what's being said there. Work with community organizations who have established trust and rapport with those from racialized communities. Take a collaborative, community engaged approach. Really nice. So yeah, this is absolutely cross-sectoral work, and Carolina is going to get into that more. Public health inspectors can be trained to look for health and safety issues, done in San Francisco and elsewhere. I love that. Public health inspectors are in restaurants and nail salons and all sorts of workplaces and interact with workers all the time. Hours of availability, great, yeah. So just like in Peel, they had after hours clinics to reach shift workers and people with changing schedules. All right, thank you so much. I see more people typing. I am going to move us along and pass it over to Carolina.
Wonderful. Thank you, Rebecca. That was great. So the next role is partner with other sectors, because we know we can't advance all of decent work on our own. So this one is really key. But in the context of decent work, this specifically means partnering with workers and worker-led groups to create, implement, and evaluate strategies for decent work with a focus on building relationships to promote mutual exchange, shared power, and decision-making. It also means joining and supporting coalitions and networks with those in research and academia, for example, with government, such as those in occupational health and safety, like inspectors, as well as the Ministry of Labor. It also means building relationships through professional associations, so either nationally or provincially or discipline specific, also with those in primary care who might see clients who are directly experiencing impacts from work, such as injuries, and community organizations, such as nonprofits who do research, for example, on the work. I'm thinking particularly like the Institute of Work and Health, other research hubs, and worker-led groups. It's important that these relationships are sustained over time and not just in times of crises, as pre-existing relationships and networks facilitate rapid dissemination of information, as well as allow us to implement or modify public health interventions. So, who exactly are these workers and worker-led groups that we keep talking about? Well, as Rebecca mentioned earlier, decent work is a movement in Canada, one that is actually really vibrant and includes a lot of worker-led community organizing groups whose membership consists of workers with lived experience of precarious employment and hazardous work. This includes groups like the Migrant Workers Alliance for Change, which is a national group, the Justice for Workers in Nova Scotia, as well as in Ontario, Gig Workers United in Ontario, Worker Solidarity Network in BC, and the Decent Work and Health Network in Ontario. Some practical first steps to connect with worker-led groups in this partner with other sectors role is first identifying the groups in your area that are addressing precarious work. This can be kind of tricky to find. So you can also go to unions, for example, or if you're having a hard time finding groups in your area, you could try looking at national groups or groups from a neighboring jurisdiction to get your foot in the door and see who they might know in your area. You could set up an exploratory meeting to get to know them. Some questions you might want to consider are, what are their priorities for decent work? How do these priorities intersect with your public health portfolio or your work? And how can you, or as an organization, support and amplify their messages for decent work? I've got some tips and strategies as a community organizer myself in terms of how to get in touch. One of those strategies is simply join a mailing list, get involved, or rather get up to date with what they're working on and the priorities that are coming from workers. You can also join a workshop, an open meeting, or a community event. And often these are spaces where community organizers do a lot of political education to develop shared analysis of important decent work issues that are happening on the ground. Another tip is to start small. Just showing up is enough to start, especially if you're showing up consistently. And from there, you can take baby steps. You can share relevant public health research. You can potentially start talking to your coworkers about this or bring it up at team meetings, but starting small is a good place to start. And be curious and open-minded. Community organizers and community organizing is a discipline. There is a lot of expertise involved with change making, with making organizing decisions that foster inclusivity and equity, with developing member-based priorities, mobilizing, and there's a lot in public health that we can learn from it. So let's put this all together with an example from Calgary Zone, Alberta Health Services. Their initial public health response to a large COVID-19 outbreak at a Cargill meat processing plant had limited engagement with workers. We know that Cargill meat processing plant, a lot of those workers are disproportionately racialized, newcomers working on low wages, with hazardous work conditions. And their initial public health response, because it had limited engagement with workers, they were unable to adequately consider and address the precarious employment, housing, and transportation conditions that impacted COVID-19 transmission at the meatpacking plant. And so the outbreak grew. It was only when they started to work with primary care, the plant workers themselves, unions, and community groups such as Filipinos Rising and Action Dignity that they were able to adapt the response and meet the worker needs. And so they built worker power by including workers in the decision-making process and implementing their recommendations in the public health response. So with this example, we now conclude the partner with other sector roles, and you know what's coming, another Slido. So we're curious to hear from you. Who are you inspired to connect with to advance decent work? And this is the multiple choice, and I believe that you can select multiple options here. So we're seeing some responses here from folks about community groups, professional associations, researchers and academia, government agencies and personnel. It's kind of fun to see it grow in live time. 100% for community groups. That's great. Nice. So we have community groups, including nonprofits, unions, labor organizers in the lead still. Professional association, sorry, as second. Government agencies or personnel as a close third. And researchers in academia now taking third. Now it's back and forth. Lovely. Okay. With that, I'll pass it over to Rebecca to talk about the last public health role.
Thanks. I was giving major Olympic announcer vibes.
I know, right? That was fun.
Okay, so the final role is to participate in policy development and advocacy. And there's two main parts to this role. So the first part is participate in analyzing the gaps and developing a decent work agenda for legislative and policy change to reduce precarious employment and hazardous work. And the second is to advocate for that agenda. So I know that this might sound lofty, it might be beyond your scope or feel even impossible. So I'm going to break down what we mean by decent work policy agenda and some specific actions you can take. And changing our public policies and employment standards laws can meaningfully reduce precarious employment and hazardous working conditions. This is really important upstream work. And as a reminder, stronger employment standards create a solid floor of worker rights that protect the most vulnerable workers. It's important, healthy public policy, and it's essential to decent work. Earlier, we did that Slido and we talked about how decent work intersects with public health domains and different determinants of health. I'm going to return to that now because we recognize that public health organizations will likely not have direct control over decent work public policies. So this will lie probably with the Ministry of Labor and Minister, for example. But there are many parts of our work that intersect with decent work, and it's important to know where these intersections are so you know what levers you can pull when doing this advocacy and policy work. And you don't need to be a policy analyst. I know we have some on the line, or a formal leader like a medical officer of health to do this work. There's a lot of examples about how this might intersect with determinants of health that are part of your portfolio. So food systems. This image on the slide is from a new resource from our colleagues Bernice Yanfil and Diane Oikel about food systems and health equity. And it outlines how decent work intersects with every stage of the food supply chain and with our food system. Food security. So Carolina already shared an example of how decent work intersects with nutritious food basket monitoring and reporting. And I'll give some examples about how decent work intersects with poverty reduction, which we saw a lot of in that Slido, and with climate resilience, which we know is a really pressing priority. And yeah, just to say that there's always an opportunity to advocate for decent work, and finding these intersections can point you to where your expertise and stories and relationships and networks are that you can tap into. So let's get to some specific actions you can take. So the first one is learning about the policy priorities of worker-led groups. And Carolina already walked us through how you can get started with building those relationships. You can also participate in decent work coalitions, intersectoral coalitions, or you could convene partners if there's not already a coalition in your area, where you can coordinate your strategies and share resources to advance decent work policies. You can collect, analyze, use, and share public health data or stories from your practice about the health impacts of precarious employment to frame decent work policies as health priorities. You can share your concerns as public health professionals about precarious employment, and you can express support for decent work policies with decision makers through consultations and at cross-sectoral tables. If you're in a communications role, you can build public awareness about decent work and the connection with health through communication campaigns, op-eds, media interviews. You can host Know Your Rights workshops for residents in your area. You can partner with worker-led groups to do that. And then the last one is something everyone can do, which is spread decent work narratives in your life, with your teams, through your programs. And we have one up on the screen. So everyone deserves dignified and safe work that allows them to thrive. So this is an example. We've really seen this work. So in 2021, Public Health collaborated with community organizing groups like Decent Work and Health Network in Ontario, other labor groups and professional associations, unions, to call for paid sick days in the face of the pandemic. So medical officers of health and other public health professionals used data and expertise to call for paid sick days through op-eds, media interviews, press conferences. Public health leaders worked together to write a joint letter from the Association of Local Public Health Agencies calling for paid sick days. And through really consistent cross-sectoral work, this resulted in real decent work wins. So temporary provincial paid sick day benefit in Ontario, federal legislated paid sick days, and really ripples across the country. Networks and solidarity was developed between public health and worker-led groups, and public narratives were shifted in support of paid sick days, which is really important for long-term success. We've already seen in the Slido how decent work intersects with poverty reduction. So I'm loving that many of you are already seeing this as obvious connection. So employment is the main income source for most people in Canada. As such, low wages, precarious employment is a driver of poverty. So bringing decent work policy recommendations like raising the minimum wage and promoting decent work into your existing work is a simple way to do this. So you can bring this into your work related to poverty reduction, living wage, income-based food insecurity. And as an example, in Ontario, the Niagara Region Poverty Reduction Strategy names promoting decent work as an area of focus. And a final example, so we talked about how important it is, to learn about worker priorities, just like this. So this is a current campaign called Too Hot to Work from the Worker Solidarity Network in BC. And so they've done research and organizing with precarious workers and have found that workers are not adequately protected from climate change related extreme weather like heat waves. And they're calling for new protections and enforcement of existing protections. So you can go to their website to learn more about this campaign and to contribute to it. All right, and it's time for a Slido. So we've heard lots of good examples of public health contributing to decent work. And we think it's a great opportunity to hear from you in 1 to 2 words. Describe your vision for decent work policy in Canada. Is it healthy, anti-racist, status for all, equal pay? What's your vision here? Intersectional, employee power, justice. Love that. Equitable, fair. Paid sick time. Love it. Human rights-based approach. Yes. Protection, living wage, achievable, healthy and fair. Seeing living wage coming up big. So I know a lot of public health folks are working in decent work, living wage coalitions. And so bringing these decent work priorities to that work is a real opportunity. Mental health supports, inclusive, thriving wage, fully integrated into public health work, yes. Basic income, union solidarity, yes. You might be a member of a union yourself, can bring decent work priorities to your union. Okay. I want to keep going. Okay. Well, as we kind of move on to question and answer, I want to just say, I want to just let this keep going. But I think a big message is that decent work for all is possible, and it's absolutely necessary for health equity. And we've gone over the 4 roles that public health can play to advance decent work and those 3 cross-cutting approaches. So now we have some time for questions. So please use the question and answer function to ask those questions, and that will get to Carolina and I.
So we have a couple of questions already, so maybe we can go ahead and now we're big. Okay. Now we can go ahead and get started. The first question is from Lori Gray, who asks, who writes worker legislation? Provincial, federal? I feel like better laws would do so much. Do you want to take a first stab at that, Rebecca?
I think that's spot on, right? So that really falls in that participate in policy development role, right? It's so provincial and territorial governments develop employment standards and occupational health and safety laws for workers in their province. And then the federal government has the Canada Labor Code, which covers federally regulated workers. So like air, travel, and train and bank workers. So mainly provincial, but there's a federal role there too.
Yeah. And to note that the legislations are different. So for example, because of our advocacy on paid sick days, I believe that we now have permanent paid sick days through the Canada Labor Code, so the federal employment standards, but we don't have that equally throughout. So Ontario, we've got temporary paid sick days, and I believe we also had temporary paid sick days in Nova Scotia, Manitoba, in BC, we have permanent paid sick days. We have, I think, about 5, and so they really do vary. But yeah, and I think the important thing about legislation, yes, better laws would absolutely do so much work. There's a piece around both enforcing those laws. So one thing is getting to getting them into decent work policies into laws, and then making sure that we are holding employers accountable to uphold those laws. And so making sure, for example, that workers who should be protected by those laws aren't getting exempted for whatever reason. So we know that independent contractors, if you have that designation, you are exempt from employment standards legislation. And what that can happen is therefore it creates an environment where precarious and hazardous work can thrive because you're not protected by that sort of floor of employment protections. And that's often what we see with gig workers. So we saw DoorDash, Uber, all of those comments. That's kind of what we see there. They're misclassified as independent contractors, and then they're therefore exempt. So they can get below the minimum wage. They don't breaks and all of that. They have to like bring their own equipment and so on. And that can happen to a lot of other workers as well. So addressing misclassification is huge. And if you're interested in getting to know more about that particular aspect of decent work, Gig Workers United is a good place to check out. And also the policy can change, absolutely. I think back, I forget exactly when year, but there was a big changing workplaces review done in Ontario where they held consultations and they really revamped the Ontario provincial employment standards, which brought in a host of decent work policies. And so as decent work, we can either sit at those tables to offer contributions from and bring our public health data, or we can be advocating for those policies to change as we've seen in the nutritious food basket monitoring. Next question. In your experience, and this one is from Lindsay, in your experience, is it helpful for organizations like municipalities to become living wage certified as a model for other business? So I'm going to repeat the question. In your experience, is it helpful for organizations like municipalities to become living wage certified as a model for other business? Any preliminary thoughts on that, Rebecca?
Yeah, so living wage certification means as an employer, you're committing to providing that living wage for everyone in your organization, right? So I think that can be a really powerful way to be sharing transformative narratives about the fact that everyone deserves decent work and that that includes a wage that can cover your cost of living. I think what's important to pair with this living wage work is pushing the provincial government to be raising the minimum wage and addressing other parts of precarious work that impact poverty. Because just having living wage employers is not going to reach the most vulnerable workers. We really need those minimum rights and protections that compel employers and protect workers. So I think it's kind of a both answer.
Yeah, and I think to add to that, really important to also know what workers in precarious employment are calling for. So is living wage what workers in a particular municipalities calling for, and what are their decent work priorities, because it might not be living wage, it might be something else. So I think that is also a really important aspect of it all. And I think that decent work and things like paid sick days and wage is just the tip of the iceberg. There's a lot of other components to decent work, and definitely encourage folks to check out our first webinar that talks about decent work as an issue, to describe all of the different facets of the decent work demands and how they can be implemented. For example, things like equal pay for equal work. Part-time casual workers can earn less than full-time workers in some provinces or jurisdictions, and they're doing the same type of work. So that's certainly an important aspect of decent work that we should consider as well. Okay, next question. So this is a comment and a question from Dorothy. These methods and examples are great, but too many public health folks don't really get occupational health and safety hazards, don't really acknowledge the importance of work as a determinant of health, and especially in this pandemic, focus on individual responsibility/solutions instead of primary prevention. And the question is it possible to incorporate more in the decent work agenda about job-related hazards and their effects and the laws and regulations involved? Is it possible to incorporate more decent work in the agenda? I believe it absolutely is. And I think that the decent work example that we've raised about paid sick days shows that not only is it possible, but it's necessary, and our advocacy works. Anything to add to that?
I think it's part of why we're doing these webinars and these resources, right? Is to try and start bridging some of those silos. Yeah.
Yeah, absolutely.
Should we move on? We have 2 minutes.
Oh, we have 2 minutes.
Okay, 2 minutes.
We have 2 whole minutes. This question, what are some areas of legislation that influence precarious employment? We know about ESA, but what other legislations? Rebecca?
Yeah, so things like federal employment insurance, those are a safety net, right? They cover parental leave, sick leave, caregiver leave. Immigration policies really impact decent work for migrant workers. Things like sex work labor laws, right, that impacts the decent work of sex workers. Things like human rights, accessibility, pay equity. And Carolina, what were you saying?
I was saying criminalization of certain types of work, or the lack of acknowledgement of, for example, care work as well.
Let me share my screen and get the Slido up, and you could keep answering questions if you.
I think we can move on. I think that's good. Yeah.
Okay. Okay, so a final, as we close and wrap up, we'd love to hear what's one thing you learned today that made an impact on you. And as you do this, I'll just let you know that you can find more about our work and sign up for our mailing list at nccdh.ca. And please get in touch if you have questions we weren't able to answer, or if you have examples of actions you're taking to advance decent work. We'd really love to hear that. And lastly, please spare a couple minutes to complete the evaluation. So the link will pop up on your screen when the webinar ends. And we really, really welcome your feedback. Helps us better support you. Okay, I'm seeing some responses. So knowing about the worker networks, wonderful to know. All of the great examples from organizations. I definitely want to read more. So in the practice brief, we have links to all of those examples that provide so much more detail. And I think they're so helpful to know that this work is possible, right? Some examples you provided about action, like heat stress campaign. Right, there's a lot of heat work happening across the country right now for workers. The various ways employment can be considered precarious. There is space for very important work for all in public health. Love that. The importance of being familiar with the various types of legislation and acts federally and provincially that impact decent working conditions. And worker organizers are a great starting point for understanding those. Also, different legal organizations can help need to address workplace inequality and impact on staff, health and public health of the community. Real-life Canadian examples were very helpful. Ideas of ways to connect with both community organizations and private business to promote health in all workplaces. And learning examples of how decent work is connected to public health, as well as how to advocate. And the ABC approach, I love that. The ABCs. Okay, we are getting some final answers, and we're also over the hour. So I think a big thank you to everyone, and take care.
Thanks, folks, for joining us today. Bye now.
Bye.